Welcome, and thank you for standing by. At this time, all participants are in a listen-only mode. During the question and answer session, please press star 1 on your touch-tone phone. Today's conference is being recorded. If you have any objections, you may disconnect at this time. Now I will turn the meeting over to Ms. Portland Ridley. You may begin.
Hello, and welcome to today's webinar hosted by SAMHSA. My name is Portland Ridley, and I am a public health advisor in the SAMHSA Center for Mental Health Services Suicide Prevention Branch. And thank you for joining us today. For National Suicide Prevention Week, SAMHSA is hosting a series of webinars during the entire month of September. Suicide prevention is a top priority here at SAMHSA. America loses approximately 105 people every 24 hours to the shattering acts of suicide. The toll it takes on American communities and families is profound. Today, we will provide you with a very brief introduction of the SAMHSA-supported National Strategy for Suicide Prevention and the role of the Action Alliance, and point you to resources where you can learn more about it. Then I will turn it over to our presenters, who are leading initiatives that are advancing the national strategy. They will provide an overview, strategic framework, and application examples of their campaigns, the JED Foundation's Love is Louder and New York City's LiveWell NYU, which are inspiring initiatives that are changing the public conversation about suicide and suicide prevention. So at this time, I would like to introduce you to the speakers for this webinar event. John McVeigh is the Executive Director and CEO of the JED Foundation. Courtney Knowles is the Director of the Love is Louder campaign at the JED Foundation. Dr. Carlo Ciotelli is Associate Vice President for Student Health at New York University, as well as the Executive Director of the NYU Student Health Center. Dr. Ciotelli is also an adjunct assistant professor at Steinhardt School of Education at the Department of Physical Health at NYU, as well as a clinical assistant professor of medicine at the Department of Medicine at NYU's School of Medicine. We also have with us today Allison Smith, who is the Administrator of Public Health Initiatives and Assessment at the NYU Student Health Center. Mrs. Smith is a faculty member of the American College Health Association, National College Depression Partnership, Depression Quality Improvement Collaborative. The National Action Alliance is a public-private partnership established in 2010 to advance and oversee the national strategy. Last year at this time, SAMHSA, in coordination with the Office of the Surgeon General and the National Action Alliance for Suicide Prevention, released a revised 2012 National Strategy for Suicide Prevention. The national strategy is a call to action that is intended to guide suicide prevention actions in the United States over the next decade. It outlines 4 strategic directions with 13 goals and 60 objectives that are meant to work together to reduce the number of deaths by suicide in the nation. The revised strategy emphasizes the role every American can play in protecting their friends, family members, and colleagues from suicide. It also provides guidance for schools, businesses, health systems, clinicians, and many other sectors. You can learn more about the National Strategy for Suicide Prevention at the website link provided on this slide. The 2012 National Strategy for Suicide Prevention is organized into 4 interconnected strategic directions. Today, we will be focusing on Strategic Direction 1, Healthy and Empowered Individuals, Families, and Communities. The goals and objectives in this strategic direction seek to create supportive environments that promote the general health of the population and reduce the risk for suicide behaviors and related problems. Now, as you can see on this slide, these are the national strategy goals on this slide that come under Strategic Direction 1. You can see that 3 of the 4 goals relate to communicating, using research-informed communication efforts that change knowledge, attitudes, and behaviors, increasing knowledge to promote wellness and recovery, and promoting safe and responsible media reporting. Based on a careful assessment of the needs and available resources and opportunities, the Action Alliance selected 4 immediate priorities from the new national strategy. Today's webinar will focus on one of the priorities, changing the public conversation about suicide and suicide prevention. In general, changing the conversation is about using approaches that are safe, that promote health and connectedness, and give people an action step to take, whether they are feeling suicidal, worried about a friend, or want help. Strategic Direction 1 and changing the public conversation are about transforming attitudes and behaviors relating to suicide and suicide prevention. 2 campaigns, Love is Louder and LiveWell NYU, are examples of initiatives that are advancing this strategic direction. These campaigns are fundamentally transforming attitudes and behaviors relating to suicide and suicide prevention through messages that promote hope, social support, connectedness, resilience, and recovery through the use of widespread new and social media. At this time, I'm going to turn it over to Dr. Carlo Ciotelli and Ms. Allison Smith from New York University. There we go.
Oh.
I don't know why it's doing this. Bear with us. There we go.
There we go. So thank you, Portland, and thank you to everyone who gave us this wonderful opportunity to talk about LiveWell NYU, an initiative we're very excited about and tied to a topic, suicide prevention, that is certainly near and dear to all of us here at NYU. And everyone, thank you to those of you who are listening in today who took time out from your busy days to participate. So just a little bit about NYU itself, and you can see some of the key statistics here. In summary, it is a very large university, urban, diverse, and very decentralized, which really makes any type of new project or initiative particularly daunting. I wanted to show you what we, ironically, the slide is entitled Our Old Model for Student Health, because for the past 7 or 8 years, we've really referred to it as our new model. And about 10 years ago, there were a series of deaths at NYU, several by suicide, and it really drove a re-examination of how we deliver health and mental health services on campus. And there was a desire to reduce barriers to care, to try to increase utilization so that students who were in need could more easily access the services that they needed. And there were several interventions that we undertook, many of which are outlined in this slide. I'll highlight just a few. One of them was simply taking away some financial barriers by reconfiguring our financial model with our fee and insurance structure. We took major steps and made major efforts to intentionally develop programs that reduce stigma around particularly mental health care and educated faculty and staff. And you can see on the bottom left, the Educating Faculty and Staff for Students in Crisis Handbook. We've done a fair amount of gatekeeper training with that group as well to help identify students who are in need of care. We had major initiatives in our medical services to screen for depression and link them to the appropriate services. And part of this was implemented through our reality show, which you see on the bottom right, which was a theatrical production developed by students for students, which has multiple vignettes, many of them focused on reducing stigma around mental health services and also identifying resources on campus particularly our Wellness Exchange hotline, which you see there right below the Student Health Center, which was developed about 9 years ago, which really serves as a 24/7 hotline for students all over the world to access resources and serves as our main portal into health and mental health services on campus. The major takeaway of this slide, though, is that at the end of the day, the Student Health Center and all its associated resources stood at the center of this model. Now, our efforts paid off. You can see that this is the impact that all of these initiatives had on utilization. Traditionally, prior to 2006-07, we were seeing about 35% of students on campus in any one of our services, medical or mental health. As we implemented these various interventions, you can see the dramatic rise in utilization, and although it's begun to level off, we've actually seen 7 consecutive years of increased utilization, where we now, this past academic year, have seen over 26,000 of the roughly 40,000 students on campus, and calls to our hotline, our 24/7 hotline, exceeded 16,000, the most ever in a single academic year. Now, we look to see who the group of students were who were not accessing our services, the roughly 1/3 or so who were not. And we actually surveyed across campus, and among that group, the main reason they gave for not accessing services was they felt they were healthy. So we really wanted to see whether or not these students actually were healthy. And hold on, I think you just need to. What? There we go. 1 out of 6 of this group, and this was the group that said they were in very good health or excellent health, smoked. Over 1/3 had an episode of binge drinking in the last 2 weeks. 17% with a serious negative consequence from alcohol. Less than 10% eating the recommended servings of fruits and vegetables. Less than half getting an annual flu shot. Nearly half felt overwhelming anxiety. And again, this is among the group that was really in the best health, self-perceived best health. And over 25% feeling so depressed it was difficult to function. And just as a point of comparison, when we looked at the other students who were only in good or worse health, these numbers were all worse. So again, students' perceptions of their health and their actual behaviors and other markers of health and well-being, not quite as good as they perceive them to be. Now, this is a slide that probably is very familiar to most of you. This comes from our National College Health Assessment Survey, top health impediments to academic success, and really just to summarize 2 key points here. One is that these are largely psychosocial issues, and 2, issues that students often do not perceive the need to access health services for. Now, in that vein of help seeking, what we've also learned from data collected by Daniel Eisenberg through his Helping Minds survey is that the majority of college students who have a mental health disorder are not in active treatment. And that's an across-the-board statement. And the degree to which they don't seek services or seek help does differ significantly by demographic group, with men less likely and Asians less likely to engage in help-seeking behaviors. Now, traditional ways that we've tried to enhance help-seeking have been through efforts to reduce stigma around mental health services, addressing this notion of perceived need, social correlates, that is having a family or close friend who have used treatment, and cultural competence. Now, what's interesting is that some of those barriers, those attitudes and beliefs, don't explain all the reasons why students don't end up engaging in help-seeking behavior. In one particular study, 65% of the students with untreated mental health problems actually reported low stigma. So there was no stigma attached to mental health, seeking mental health services. They identified other issues. And some of those other issues cited were not having enough time, they felt they could deal with the issues on their own, that stress was simply a normal part of the experience, and that their needs were not serious enough. And if one goes back to think about that list, one could see how sleep difficulty, stress, issues with interpersonal relationships might fall into one of these categories here. Now, knowing that there are a host of reasons that students don't engage in help-seeking behavior, how do we get them to be more proactive partners in their health and wellness? How do we, one, get those students who are high risk to engage in the appropriate services, but also, two, how do we get all students to engage more so that they can actually help themselves? As we began to think about what type of model might help us move the needle on that, there were several key characteristics of any type of new model or new initiative that would have to be part of it. That included, first, making the healthy choice the easy choice. Second, creating an engaged and supportive community. And during Allison's part of this discussion, she'll talk a fair amount about our partners in prevention, who are key members of the LiveWell NYU strategy to create this engaged and supportive community. And finally, how do we get students to care about health? What type of dynamic engagement strategy could we develop for students? So we looked far and wide for inspiration. And where did we find it? First, we focused in on established public health frameworks, evidence-based public health frameworks, including the National Prevention Strategy, Healthy People 2020, among several others. We looked to higher education. We looked to industry, who does a magnificent job marketing all of their products and services, including a very savvy use of social media. We looked at healthcare organizations outside of college health, and we looked to see what was going on in pop culture with students that we could embed within any type of new strategy. So this is the model that we ultimately came up with, the LiveWell NYU model. And very briefly, on the left, you can see the various strategic approaches that we employ. And Allison will touch on some of them, real-life examples on how we actually converted these strategic approaches into actual action. In the middle are all of the student behaviors that we hope to see, the various processes that we hope to change with these strategic approaches. And on the right, the way that we knew that we were succeeding, all the various types of outcomes that we could look at. So one of the first things we did is develop a focus, a top 10 of priority areas that we were going to focus on. And this top 10 list was derived from our National College Health Assessment data with input from our university stakeholders. And this top 10 list are topics that meet one or both criteria that we established, in that they were issues that resulted in serious impediment to academic success, and/or that were issues that impacted the majority of students. With that said, these generally fall into two broad buckets. One's of emotional or psychosocial type issues, or of more a physical health type of issue. And as LiveWell NYU evolved and we did more research, what we had come to realize was that the interventions we were developing, the topics that we were trying to address, really were setting us up for a platform that could potentially build and increase resilience across the entire student population. And effectively, what we were doing was trying to lift the tide of emotional health, lift the tide of resilience across campus, including getting those individuals who were, quote unquote, stuck in the mud up and afloat. Again, that rising tide lifts all boats approach, where this population level set of interventions could both reduce the overall distress level of the campus and really reduce the overall risk of suicide across the entire population of NYU students. So how did we come to this thought process? If one looks at the core components of resilience, 3 or 4 jumped out really as self-evident parts of what LiveWell NYU was all about. Basic wellness, stress management, facilitating help-seeking behaviors. Again, as we looked at the other components of it, purpose, connectedness, perspective, the more we actually built content and developed the structure of LiveWell NYU, the more we realized what we were really doing was developing an initiative that helped enhance and promote resilience across campus. Of course, this approach is not without its challenges. With all the demands that students have on them, how can we help them focus on the things that give them personal value and a sense of purpose, even as they strive to excel in their academic pursuits? And we really borrowed from the discipline of behavioral economics to really, in a nutshell, say, how can we make the cost-benefit equation for a student weigh more heavily on the benefit? What can we provide them that they are going to view as beneficial to their entire student experience? And what we'll do now is show you a brief video clip that is really our year 1 in review, and then Allison will take over and drill down a bit and show you the several of the components of LiveWell NYU.
we translate that LiveWell NYU model into action? As Carlo has talked about, our goals are not only to try and reach and connect with students before they are at a point of distress, but to help students develop the life skills to actually flourish. And to do this, we need to fundamentally change our mindset and our approaches. We're empowering students to be active partners in their own health and success, and that means engaging them where they are through people who have the closest contact and influence on platforms they are already using and the content they're already interested in. Basically, leverage all the touch points of their daily lives and using more universally accessible types of content and modalities to engage students. There are many and unique touch points for any individual student. As such, our goal is to mobilize the entire campus community to work together in a united and coordinated effort to promote overall student wellness, resilience, and emotional health. But it's not enough to build interest or buy-in around health across campus. Like with our students, we need to make it desirable and easy for the campus community to take action. LiveWell NYU provides action-oriented infrastructure to support these efforts. This page has some of the key elements of that partner infrastructure. The first, if you look on the lower right-hand corner of your screen where it says click to download, this document called LiveWell NYU, a comprehensive public health framework to improve student health throughout the Global Network University, which outlines our overarching plan and strategy. It's high level, but it serves as an important tool for providing transparency, building buy-in, while educating the campus community about the priorities and high-impact, broad-reach interventions that actually make a difference. The second is a description of the LiveWell NYU approach and how they can incorporate that approach into their interactions with students. The third is the use of our stamp. You can see it above the click to download, and you've seen it already throughout this presentation. The stamp serves as a visual cue that pulls together all the pieces across campus, across all touch points, and helps students identify opportunities to make a decision or take action that can positively contribute to their overall well-being. And then the fourth, prescriptive actions tailored to each of our 4 partner groups, our student leaders, our faculty, our administrators and staff, and our families. This is actually 4 distinct websites. This is an example from the faculty website around interpersonal relationships. And as you can see, these recommendations are specific to their interactions with students in the academic setting. For example, specific suggestions for increasing connectedness among students within the class, or proactively talking about interpersonal relationship conflicts that can arise within a group assignment, which we all know are critically important skills for students to negotiate while they're in college and beyond. This is an example of the landing page for student leaders. As you can see, the language we use to describe LiveWell NYU is different. The resources available are different, and they're tailored specifically to student leaders. As a whole, though, creating this infrastructure allows us to be prescription and action-oriented, key elements of being able to develop a supportive environment. The goal is making it easy for our partners to incorporate the LiveWell NYU approach into their actions with students, promoting their events through our channels and networks, sharing the lessons we are learning in real time about what engages students, and as we know, it's ultimately about increasing awareness of resources and inspiring behavior change. Helping partners incorporate the little things that can lead to big change into their events, activities, and other interactions with students Some examples like stress reduction, reaching unengaged or disconnected students, creating connections, providing tools for simple things students can do to be healthier, offering information on campus resources. So how do these concepts, again, translate into actual action? Here are I'm going to show you 3 examples. The first is a student club event called TEDx NYU with a de-stress program, an RA event, and an administrative use in the residence halls. Knowing the priority areas, which in this case were nutrition, stress, physical activity, and having the stamp tie each of these 3 distinct opportunities together to facilitate students engaging in the desired behavior within their everyday life, again, across multiple touch points and through people who have the closest contact and influence. Next, I'm going to talk about LiveWell NYU's direct interactions with students and some of the non-traditional strategies we are using to connect, build brand loyalty, engage, and ultimately get students themselves to take action. As you might recall from our video, 4 key tenets have emerged for successfully engaging with students. Speak their language, give them new experiences, enrich their lives, give them tips for students by students. So speaking their own language, how we describe LiveWell NYU to students. It's a movement driven by students for students that helps NYU students find the simple, everyday things you can do to improve your lives. We use phrases that connect to concepts we know students care about, living it up. It's all about embracing experiences, staying active, meeting new people, and having a good time. It's the little things we can do to have fun and be fulfilled. LiveWell NYU offers students access to events, experiences, advice, or suggestions for living life to the fullest. Living free. It's not letting the pressure and stress of college life hold you captive. There are a lot of academic and financial pressures during these years. LiveWell NYU offers deals to help save cash, tips for keeping life balanced, and suggestions for getting out from underneath the stressors of college life to really enjoy every single day. Living loud is about just being you, speaking your mind, expressing your thoughts. LiveWell NYU connects students through our events and idea sharing. The next 3 slides are postcards to promote LiveWell NYU. We tried to use imagery that embolden the main concepts we want students to associate with LiveWell NYU, that LiveWell NYU helps them live life to the fullest. A lot of the content types I just talked about can be found on LiveWellNYU.com. It's the hub of our student movement. And we use technology as a way to reach students and engage students on the fringe. Through LiveWellNYU.com, our mailing list, and social networks. In the development process, there was a lot of consideration about making the website and our other engagement strategies to be specific to NYU students and to the NYU experience, but not with an explicit goal of building community. This is important because we want to make sure that students who are not connected with NYU student life, whom we know are already some of our higher risk students, feel welcome and that LiveWell NYU is relevant. This is also where all of the touch points such as things to do and deals in New York City are so useful. We use our partners, technology, and events to bring students together with common interests so they can feel connected, even if not to the larger NYU community. We also use the student voice with content developed for students by students, although it is worth mentioning that we have a review process to ensure that all content, even developed by students, is factually correct and inclusive. A key strategy Carlo and I have talked about is using this behavioral economics approach, pulling students in with the types of content and opportunities we know they want. Free stuff, deals, quick tips, access to events and new experiences. Or in this case, a video that happens to be trending right now. Deals and free stuff, events at NYU and in New York City. Our Voices section is an easy way for students to share their ideas with other students. Other fun content, but I do want to draw your attention to the section below Quidditch where it says related content. And this is where we actually integrate health information and behaviors we want them to engage into their overall online experience and using the student voice. Even health tips, like the Circle of Six app, which is a violence prevention app, or Chipotle, which addresses nutrition issues, are written as for students by students advice, not like traditional health education pamphlets covering those same topics. Another key strategy is integrating experiences and giveaways into events that students enjoy and pass along as a way to connect with them on an ongoing basis. LiveWell NYU has become well known for our photo activations, which provides a digital postcard that not only creates a memorable experience for students, but also uses cutting-edge technology, spreads the word about LiveWell NYU to other students, and connects all participants to the LiveWell NYU newsletter and social networks, where they are going to receive ongoing tips and opportunities to improve their lives. As I'll show you later, the overwhelming majority of our newsletter subscribers are a direct result of participating in one of these photo activations, most of whom would not have otherwise joined a quote-unquote health newsletter. Welcome Week is the perfect example to show how this strategy all comes together for students. Welcome Week is our orientation week at NYU and includes over 500 events to help acclimate students to the university and New York City. Although we easily could have a traditional info session about living well or do a show and tell of LiveWell NYU resources, which would at most engage a few hundred students if we were very successful. We chose to subtly integrate LiveWell NYU concepts throughout all of Welcome Week. For example, we identified approximately 200 Welcome Week events that are very much aligned with LiveWell NYU. In the event management system that students use to RSVP for events, we used our brand to stamp each of these 200 events as LiveWell NYU featured. We had a physical presence at marquee events like the Inter-Residence Hall Council Bed Bath & Beyond After Dark, Casino Night, the Friday Night Glow Ball. We captured over 2,000 email addresses through these events in one single week. The names of the events don't really matter, but the takeaway being that we are able to use these fun one-time opportunities where students already are and use them as a way to connect with students in an ongoing basis. Live Your NYU Collages. I won't go into a lot of detail, but this is a campaign to engage incoming students prior to them arriving at NYU. It's just another example of using technology and leveraging what students' frames of mind, being excited about starting NYU and moving to New York City, while also using the voice of upper-class students and giving those students purpose. And then finally, this is actually my favorite campaign we've done thus far. The concepts and strategies are consistent with everything else Carlo and I have talked about. The idea came entirely from a student who wanted to make Valentine's Day more than just about romance, which can be very depressing and upsetting for some students. The idea was to leave anonymous Valentines randomly throughout campus to be found by other random students, with stationery included, so students could easily pass along their love to others. We encourage students to use specific social media hashtags when they either lost or found a Valentine. It gave students making the Valentines a sense of purpose and connectedness, and for students who found the Valentines perspective and connectedness, core component of resilience. Of course, it's great that we can engage students with the types of content and opportunities we know they want. Again, free stuff, deals, quick tips, access to events and new experiences. But we have very encouraging year one results to suggest that this strategy actually translates into action. This slide shows that consistent with our strategy, the majority of students are finding out about LiveWell NYU through campus events and participating in our photo activations. They are interested in deals, events, experiences, and advice. Using the student voice, we are actually getting students to view our content. Our most popular video, Stuff NYU Student Day, has absolutely nothing to do with health, but it's yielded now over 43,000 views, and attracts students to our YouTube channel and our website that, again, would not otherwise have come for traditional health. That engagement is translating into long-term connection with students. They're engaging long-term with the website and staying connected via our newsletter and social networks. The success in reaching and establishing initial engagement with students can best be assessed among our freshmen, the first cohort to be fully exposed to all elements of the LiveWell NYU approach. So among our first-year students, 70% are aware of LiveWell NYU. 40% received emails from LiveWell NYU, and 44% visited the website. As you might recall from Carlo, the second tier of the LiveWell NYU logic model is that once students are engaged, LiveWell NYU increases their knowledge and skills. And to that end, through the use of our 2013 National College Health Assessment Survey, demonstrated that among all students who visited LiveWellNYU.com, 84% actually learned about one of the following: a fact, tip, or opportunity to help them be healthy, a student health center, health promotion program, service, or resource, the other campus organizations, offices, resources, or services. The LiveWell NYU logic model outlines that after engaging students and imparting them with knowledge and skills, that students will be able to take actions that will lead them to be healthier. The data suggests that students are taking action after engaging with LiveWell NYU. In fact, 58% took action, which includes everything from looking for additional information on a topic or idea, or actually changing the routine or adding an activity to be healthier. And we're getting information about health topics. As you can see, these tie back to our priority areas, and we're getting that information about the topics that most impact our students to them. Those students who visited our website, because they're coming in through non-traditional ways, we are still getting them the information they need to be able to take action. And ultimately, we are most interested in improving outcomes. We are using the ACHA-NCHA survey to track population-level health improvements related to NYU's leading causes of academic impediment, morbidity, and mortality. I hope you can see how LiveWell NYU is an innovative strategy for supporting the NSSP strategic direction through building social connectedness, promoting overall wellness, resilience, and emotional health, and hopefully that we are lifting the tide of health, resilience, and emotional health for all students on campus. Thank you. So at this point, I'm going to turn it over to the Love is Louder group.
Okay, thank you, Portland. This is John McPhee from the JED Foundation. Thanks, everybody. It's a pleasure to be here today and part of this webinar. Thank you to Portland, to SAMHSA, and to the National Action Alliance for inviting us to talk to you today about our Love is Louder project. Just quickly about the JED Foundation. So we are a nonprofit organization headquartered in New York. founded about 13 years ago with the mission of promoting emotional health among teenagers and college students. As Carlo and Allison talked about, we know that emotional problems such as anxiety, depression, substance abuse are threatening the well-being and success of college students today. In terms of this work, if we look at it on a national level and consider that there are about 20 million students in institutions of higher education, and the fact that most mental illness, most major mental illness will first manifest between the ages of 18 and 25, taking that scale and some of the statistics which were reviewed earlier, such as some 30% of college students report feeling so depressed and 50% so anxious that it was difficult for them to function within the last 12 months. We can see the absolute importance of this mission and of doing this work to promote emotional and mental health among young adults today. The JED Foundation is specifically working to empower students and parents to be proactive about their emotional health during the college years and to build life skills and resiliency among young people so that they can weather the challenges that will surely come. We're also working with schools to create campuses and communities where students feel connected and supported and where they're willing to ask for help when needed. And we're working to help schools create safer, healthier campus communities. Specifically in terms of our programs include JED Campus, which is a new program which offers the ability for schools to take a self-assessment and get feedback on how they can enhance their mental health and suicide prevention programming. U-Lifeline, which is an online mental health resource center that helps students understand and address mental health conditions. Half of Us, which is a partnership with MTV, which is also a mental health resource center online and public service announcement campaign that uses online and on-air programming to share stories and encourage and foster help-seeking among young adults. Transition Year, which is an online resource that's focused on parents and high school students with the goal of helping to ensure a smooth and healthy transition from high school into college life. And then Love is Louder, which we'll specifically talk about today, which is a movement that helps individuals, communities, and schools build resiliency, create connectedness, and promote acceptance. And then in addition to these signature programs, we have a portfolio of additional resources that help campuses promote emotional health and protect at-risk students. So with that, I'm going to turn the presentation over to Courtney Knowles. Courtney is the director of Love is Louder for the JED Foundation and is also the creator of the Love is Louder project. So with that, Courtney, presentation.
Okay. Am I on?
Yeah.
We're on.
Okay, good. Hello, everyone. Thanks for letting us share a little bit about Love is Louder. LiveWell NYU did a lot of the groundwork for me in talking about resiliency and resiliency's role in the issues that we're really here to talk about today, mental health concerns and suicide prevention. So I kind of want to take you through the Love is Louder story as we experienced it, because it was one of these situations where, while we spent a lot of time and energy developing programs in a very intentional way and learning a lot about the way youth engage around topics of emotional health, in the end, Love is Louder was a bit of an accident. You may remember in late 2010, there was a lot of news coverage of suicides that involved bullying. Probably not any sort of increase of the occurrence of these, but just a sudden and intense media interest in covering them. And so there was a lot of conversation about this off and online. And particularly we were looking online where there was a lot of anger, confusion, a lot of memorializing that was happening of people who had died. And all of those things, while I guess natural responses, we don't know that any of those lead us to the positive outcomes that we want. to prevent distress and suicide in other people. So we launched Love is Louder really more as a way to change the conversation for one that was problem-focused to one that was more hopeful. And while certainly Love is Louder is part of, and we are big advocates for campaigns that are specifically targeted at preventing bullying, discrimination, and mistreatment, we also wanted to send the message that, you know, internal or external voices that are bringing you down, you can kind of overcome those, and there are things that are more powerful than that, whether that be help, support, or connection. So an actress that we had worked with for a while, Brittany Snow, was one of the first people to kind of suggest this approach and get involved with us, and we developed the Love is Louder concept and brand very, very quickly, and rolled it out, again, really just to change a conversation. And as we were rolling that out, MTV was drawn to the idea and worked with us in launching that. I actually just realized 3 years ago today, so welcome to our birthday party. So we rolled it out, and then we, you know, really just watched what happened. And I kind of want to just show you this video now that really recaps kind of the start or the beginning of Love is Louder, and then I'll go from there at what we saw, the lessons we learned, and how we evolved this really idea into a larger program. And our friends at NYU are going to actually play the video for us because I couldn't figure it out.
Just a minute, sorry.
That's okay. I can keep talking, actually. One of the things you're going to see, and just play the video over me, Allison, that's fine. And that'll be my cue to stop talking. One of the things you'll see in the video is that it's starting.
Is it? Here.
Love is louder than bullying, than hate. Love is louder than fear, anxiety, insecurity.
Love is louder than discrimination. Love is louder than abuse. Love is louder when you take action to help yourself or a friend.
I had experiences in middle school and high school with a bully. You're not alone in this, and there's so many people going through the same thing or have been through it. And it's really important to reach out and just know that you are stronger than any words that bring you down.
Love is louder than anybody's negative voice. Keep on you.
Love is louder than fear. Love is louder than ignorance. Love is louder than pain. Love is louder than anything.
We will stand up to these bullies, and we will stand up with love, because love is more powerful. Love is love.
On our Facebook page and on Twitter, we also have thousands of people who have uploaded pictures and stories and said that they've gone through similar experiences.
Hello, Allison?
Yes?
Oh, can you all see the video?
I can't see the video. I don't know if you're showing it from your desktop.
There had been people requesting access, and then it went off.
Okay. You know what? Why don't we? I will share the links to the videos afterwards, and we can do it that way. That's not a problem.
Do you want to go back to your slides?
Yeah, that'd be great.
Okay. Well.
So basically what the video was going to show is that shortly after we launched Love is Louder, to our delight, but also to surprise, young people, teenagers, and college students across the country had embraced it as a way to talk about a range of issues. We really pushed it out to be about this bullying and mistreatment and feeling isolated and alone, but the uses of it that we saw in social networking ranged from self-injury to eating disorders to depression to articulations that people didn't understand the pain that they were going through. And so really in a intentional and non-intentional way, we had run across a way that teenagers and college students seemed willing to talk about these issues. And you all know from your day-to-day work that it's not always easy to engage students around these issues. And as LiveWell NYU talked about, sometimes we have to be creative in the messaging points that we use to bring people in, and then how we work to kind of turn that into positive action. But clearly the initial response, including one of the things in the video that showed, is there was a YouTube video of hundreds of college students chanting Love is Louder that actually came online just a couple of days after we launched the movement. And so we really spent about a year watching the way that people were using Love is Louder and the types of things that they were doing, because they took it, the actual users took it from an online experience and took it into their communities, and were using it as a way to deal with a wide range of issues, again, from inclusivity to encouraging help-seeking to preventing negative or harmful behaviors like bullying or discrimination, to just feeling more connected as campuses, schools, communities, or groups within those campuses and schools. And as we watched it, we realized that what Love is Louder was accomplishing with students was something that we had been working with schools like yours and as an organization at the JED Foundation on doing for a while, which is using the connection points we had online, through the media, through events, to meet a couple core areas of the JED Foundation and SPRC's model for promoting emotional health and preventing suicide on campus. And many of you may be familiar with this model. If you're not, that's information you can get at jedfoundation.org. But each of these bubbles or areas represents kind of a core a competency or area that we need for these comprehensive plans and programming. And on the promoting social networks, making people feel more connected, developing life skills, building resiliency, the components of which LiveWell NYU talked about and we'll talk about a little more in a second, and then just encouraging people to increase, to seek help, whether that be by making them more comfortable with the concept, by making them feel like it's a community that will support them if they speak up, or by empowering or inspiring one of their friends to help be the conduit to getting them to speak up. And so we've learned some things through our work with Love is Louder, also through our work with the JED Foundation's work with Half of Us with MTV. And I thought I'd just, before we dive into the structure we've created for Love is Louder and what the program is, just recap those a little bit. And that's, while we know from research, like the research that NYU shared, that emotional health and health overall should be a priority because it influences all of the factors and life goals that students care about, it's not always a top priority. And especially in the college student world, we do hear about this notion that kind of being run down and overwhelmed is the norm, and so people don't think much of that. If you've ever seen or tried to have a conversation on social networking about things like warning signs of depression or warning signs of suicide, you know that it is really difficult to get this demographic engaged in those conversations, especially the people we're most concerned about who aren't the advocates that are already connected to the cause. So it's not an easy thing to get them to talk about. Creating new channels and events and experiences. You know, I always kind of make the joke that, you know, you shouldn't be surprised when no one comes to your depression fair, because that doesn't sound very fun. And so instead of trying to create events that are about specifically the topics that you're trying to approach, trying to find ways to integrate into events where students already are, again, the photo activations that LiveWell NYU talked about are a great example of that, and we find photos to be kind of a powerful engagement point too. And then focusing on small actions. One of the things I think that we at the JED Foundation all collectively realized is that a lot of the campaigns that are around, whether it be on a national level, on a campus level, have really one call to action, which is call a hotline or go see a mental health professional. Well, we know from various surveys that are done in the college demo that there's a high percentage of the population that says they wouldn't consider seeking help. So if we make the only call to action the big one, there's a big part of the audience that we lose, and we've missed an opportunity to potentially get them to make a smaller action or a smaller commitment that over time could lead to the bigger actions we want them to take of help seeking, speaking up, lifestyle changes, all the different things that we know can support emotional health and prevent distress and all the negative outcomes of that, whether that be substance abuse, academic failure, suicidal ideation. So at the end of this probably about year period that we kind of watched Love is Louder and nurtured it a little bit and talked to the advocates on the ground who had really took it and run with it, we articulated a mission of what Love is Louder actually was. And that was a movement that works online, through the media, and in communities to strengthen emotional health by building resiliency, creating connectedness, promoting acceptance, and equipping advocates to support their peers. So a little bit of this will sound familiar because the core basis of resiliency is something that you are probably hearing about and working on your campuses. It's certainly a word that we hear a lot now, but also LiveWell NYU just went through it. One of the things that we think works about Love is Louder is one, we're solution focused. And there seems to be a trend that's happening, whether it be in the nonprofit community or on campuses, where there's a lot of efforts to raise awareness of problems. And I think as a field, we're starting to question that a little bit, because while raising awareness of problems is great when you're trying to raise money or get policy changed, when you're actually talking to the people experiencing the problems, raising awareness may not in and of itself make things better. And in some cases, it can make the problem seem more overwhelming. Statistics that show a great majority of people are dealing with an issue may leave the message that, well, if everybody's dealing with it, why do I need to speak up? And for those who have tried in different ways to overcome their situation, whether it be feeling mistreated, feeling depressed, it can just reiterate to them how hard it is for things to get better. Another thing we're really proud of about Love is Louder and really allows us to have this real-time testing ground is where I've certainly worked on a lot of campaigns targeted at this demo where we spend a lot of time and energy and money trying to recruit them. They're really the reason we decided to turn this into a program. So we had them engaged and involved in the beginning. And so of the 150,000 Facebook followers and 60,000 Twitter followers, the great majority of those are actually teenagers and college students in that 18 to 24-year-old age group. And then we're really building the actions that we want people to do around what we know works from a resiliency standpoint and the research on resiliency, and what we've also seen work in the communities that are using Love is Louder. Doing a time check here. Okay. I'm actually going to go through this pretty quickly because we already went through kind of some of the core components of resiliency. But when we look at the specific things Love is Louder is trying to do through engagement, get people to dismiss the beliefs that make them feel bad about themselves, that they're not good enough, that they need to be perfect, to identify at least one person they could go to if they needed to talk or seek help, to override some of those internal or external voices that are making them feel bad about themselves, to practice kind kind of the positive psychology behaviors that we know are effective in making them feel connected and more fulfilled, gratitude exercises, doing things to improve their communities. Feeling part of a community, that connection point, is something that obviously comes up so much when we're talking about emotional health and suicide prevention, and having kind of the empowerment and the information they need to look out for their friends. Ours is a national kind of online and media campaign, so it may be a little different than some campus-based campaigns, but I spent a lot of time when we were first developing this and other initiatives talking to suicide prevention experts and saying, what can we do for people that are actually suicidal through these mediums? And the universal answer was kind of not a lot. When people get to that point of distress, it generally is going to take some sort of direct intervention in their world. So if we focus all of our attention on campaigns like this on the people who are in that level of distress, we miss opportunities to potentially connect with people who are not there yet, who we can get to seek help before they get to that level, or the people that are in the lives of those students who can actually help them. So I'm going to go through a little bit now about what we're doing now, because I want us to have time for questions. One of the things we found really powerful is using the voices that they already listen to help deliver our message. And you can see here we've been lucky to get quite a few high-profile people involved. We, again, where they are on Twitter and Facebook from an online standpoint, but also, as Allison talked about with LiveWell NYU, it's really important if there's events that are really popular on your campus or your community already, those are great access points to try to integrate into. I will get you all a video link to the recap video of some of the stuff that we did this year. We had the opportunity to actually go on a 7-day tour from New York to New Orleans, and we planned the whole thing real time on social media, just finding out who was doing Love is Louder activities in their communities as we were approaching those towns. And it was an amazing opportunity to get to spend a full week talking to people who had kind of been changed by the movement or who were using the movement to improve their schools or community. Walk through some kind of the programming tactics that we're actually doing now or working on launching soon. LoveIsLouder.com. Right now there are action kits, and it's certainly the hub of our activity if we need people to learn more. Very soon we're going to be launching a new version of Love is Louder that takes that to the next level and lets people kind of create their own action pages, where every time we suggest that they adopt a new behavior or participate in a campaign with us, they can kind of capture that and track that, and it will be integrated into their social media. Love is Louder clubs. This is something we're really excited about. We're on the final legal stages of doing everything we need to launch these. Clubs already exist. Turns out people didn't ask us permission. They just started them, which is wonderful, and we are really basing our model on what we've learned from these clubs that are working. But our hope is to launch about 100 of these in high schools and colleges across the country in the coming year. We have several hundred schools that are already interested, so we think that's going to be really doable. And the purpose of these clubs will be adaptable to an extent to the needs of who started them and the communities that they're in. There will be some that are very mental health focused. There will be some that are more about inclusivity and connectedness. There will be some that are about other causes that are related that they're trying to tackle. But the way we're really defining it is clubs whose primary purpose is to make their community more inclusive and supportive and a place where people can and will get the help that they need. The tour I already mentioned, and we're going to kind of keep doing that. It's just kind of an amazing way to see how people are taking this concept and using it to make change. One of the things that we really try to do is find moments in popular culture where films, TV shows, books are making people think about relevant issues and churning up emotions and then turning those emotions into action. I think it's a pretty common occurrence now in our media-saturated a world that we see something, whether it be a YouTube video or a movie we go to see, that really makes us think and inspires emotion that sometimes can be hard to process, but then what generally happens is we leave and we go do the next thing in our lives, and, you know, that moment is past. And so we want to work with these very powerful media experiences, if you will, and figure out ways to turn that into action. So, you know, we developed an action guide for the Bully movie and the Bully Project that they share in the schools where they show that. Right now we're actually coordinating screenings of a movie called Call Me Crazy that came on Lifetime in April. Brittany Snow, our co-founder, is the star of that movie. It tells 5 different stories about people and families of different ages and types dealing with mental illness, from depression to schizophrenia. And so that'll be one of the takeaways at the end of this. If you think that's something you can integrate into your campus, we have gotten permission from Lifetime to coordinate those screenings, and then we've developed materials that help you, you know, inspire the attendees to action after they see that film. We were integrated into a recent tour with Foster the People. We even did something with Kesha in one of the episodes of her reality show that dealt with bullying. And we're really proud to be part of a docudrama hour-long show that is premiering on MTV on October 10th called Life Continued, Defeating Depression, which profiles 2 college students who both at points in their life were suicidal, and through support and treatment, you know, now have kind of reclaimed their life and are moving forward. And we're proud of it because I think it's a very realistic portrayal. I don't think it sugarcoats what recovery or life in college after you've addressed your issues looks like, but it certainly gives a hopeful message for that. Another thing that we're going to do, you know, one of the core tenets of Love is Louder, obviously, is the focus on the positive. And there's a lot of people online, young people with very, very powerful voices that often tend to show their concern or their disgust with things that they're seeing by reposting and retweeting them. And what we want to do is really teach them how to use their voice to focus on solutions instead of problems, and encourage the followers. Some of them have millions of followers, whether it be a fashion vlogger or a, you know, young celebrity, encourage their followers to speak up and ask for help if they're struggling. Straight Up Love is Louder is an example of one of the activities that we'll be rolling out through our clubs. This is actually a program that was developed by students out of a high school in New York City, Trinity School, or I guess a all-ages school, Trinity School, where athletes and maybe some members of the community that are stereotypically the ones that bully others, and specifically the LGBTQ community, made videos saying that they wouldn't stand for that in their community, and that they supported everyone in their community. And that video campaign really made their culture a more inclusive, supportive place, and so we're using that model to roll out to other schools in hopes that it'll do the same thing. So after all of that, here are just some quick ways that if you're interested in Love is Louder and potentially how it can help you on your campus, maybe not change what you're doing, but maybe even offer up a new entry point that we're seeing works, or a brand that engages that then can lead into the things you're doing. We have action kits on our website. They're designed for students, but certainly you can work with your students to do events on your campus that tie in Love is Louder and these emotional health messages. Obviously, with the club program, if you run across people who want to do something but they're not quite sure how to kind of capture that or what that might be, that could be a great way to start. Like I said, we have worked with many schools who have an existing program, whether it be a depression screening day or something that's for the LGBTQ community, who found that incorporating Love is Louder into the brand just makes it resonate in a way that's more relevant for their students. The Call Me Crazy, Love is Louder screenings, those are happening now, so if you're interested in that, you can let us know. And side note, not directly related to Love is Louder, but I know some of you use Half of Us as a resource, which is connected to Love is Louder as well, and we are launching a new halfofus.com website within the next week or so. So be on the lookout for that, because I think it's going to be an even more powerful resource to help your students kind of find ways to deal with how they feel or the situations that they're facing. And that's all. That's the overview. So hopefully we'll have some time for questions now.
Great. Thank you, Courtney. And yes, thank you, presenters. At this time, I'd like to ask the operator to open the lines for questions, please.
Thank you. We will now begin the question and answer session. If you would like to ask a question, please press star 1. You will be prompted to record your name. To withdraw your request, press star 2. Once again, to ask a question, please press star 1. One moment. At this time, we have no questions.
Okay.
I'm going to hope the technology is not working, because somebody has to have a question. I'm playing.
I know, I'm sorry. I'm just trying to transition to the SAMHSA slides. Coming up.
We do have some questions that have queued up. Would you like to take them?
Yes, please.
Rita, you may ask your question.
Hi, this is Rita Tybor calling from Miami-Dade College, and I love the presentation. Have you had any community colleges with working with the Love is Louder campaign?
We have, actually. I can't, off the top of my head, I can't remember if any have started a club, but I do know that we've had some community colleges who have done events, and we have a number of community colleges that are doing the screenings of Call Me Crazy. You know, I think one of the things that can work well, I know one of the challenges you face as community colleges sometimes is with all of the commuters, it's harder to create a sense of community. I feel like with Love is Louder, you can kind of attach it to things that are happening on your campus or things that are happening in your community, and it feels really relevant. But certainly, we've had schools of all types who have used it.
Thank you very much. And if there's any community colleges that are listening, maybe they could contact Portland Ridley and we could share some of their experiences.
Great. Thank you, Rita.
Thank you. All right.
Our next question comes from Nancy. Your line is open.
Hi, this is Nancy in Albuquerque, New Mexico. Would your Love is Louder action kits be able to be used in a high school? And also, is there a charge for the kits, and how much might that be?
No, there's no charge, and actually, yeah, high schools and colleges we developed them for. The action kit is I don't want to call it nondescript, but it basically kind of leads the user through a planning process to think about how they can coordinate a Love is Louder event that's going to work for their audience and that will inspire people to take action and, you know, not just take fun pictures and then go home. So the suggestions in there can be used by high schools or colleges. There is no charge. And when we launch the clubs, which we're hoping is very soon, we're going to be launching an even more expanded center with resources, with suggestions for actions or activities. And then the last thing I'd say is if you are working with a college or a high school that looks at the action kit and doesn't feel it like it's meeting exactly what they're trying to accomplish, just email us at info@loveislouder.com, because while the long-term goal is to kind of provide tools so people can be self-sufficient. In this time where we're trying to build these programs, we do like to work directly sometimes with schools to develop programs that work so that we can share those successes with other schools.
Thank you.
Our next question comes from Darcy. Your line is open.
Hi, my name is Darcy Andrus with Modesto Junior College in Modesto, California. And we actually signed up for the Love is Louder, the Call Me Crazy screening. And I just have a couple questions. We received a mental health grant through the state of California, and we're trying to launch a few different things to reduce stigma. And I know that the students on campus keep asking about speakers. Do you guys have any speakers that are willing to travel or whatnot? I know California received a lot of the junior colleges received this mental health grant. So I know if I'm interested, quite a few others might be interested as well. So I'm just wondering if you guys have any speakers that are willing to come to the campuses and talk about Love is Louder and reducing stigma about mental health.
Yeah, the Speakers Bureau is something that we're working on. We have a couple of speakers that we have been doing that with when there are opportunities, where there's a budget to kind of help cover costs and travel. So I would say just shoot me an email at the info@loveislouder.com and let me know kind of the time frame and what you're looking for. But hopefully soon we'll have something up that kind of profiles more opportunities for that. If you email and we don't have somebody that's in that time period, I can also refer you, to some other people that provide speakers like that and that we've worked with Love is Louder.
Okay, great. Thank you.
Our next question comes from Yvonne. Your line is open.
Hi, we were just trying to get some more specific information regarding the screening for Call Me Crazy. We are considering making that happen at our campus. Just would like to know who would we contact.
You can just email the info@loveislouder.com, and to Darcy who just talked, and if anybody has got screenings planned now, that we the DVDs that Lifetime originally gave us had a glitch and they were freezing up, so we've now got new DVDs and those are all going out today. So if somebody happens to be on the line and you're wondering, your DVDs are coming. But all you need to do is let me know. It's really, really simple. All you have to do is sign a license agreement saying that you agree not to bootleg the movie, and we give you some planning materials and send out the DVD.
Thank you. And Courtney, how can they contact you about that?
Actually, let me give you my email address too, because that might be easier. For the screenings, you can actually email screenings@loveislouder.com, and that'll go directly to for the screenings. And then if you want to talk about doing some sort of other programming on campus around Love is Louder, my email address is cknowles, so it's CKNOWLES @jedfoundation.org.
Great. Are there any other questions?
We have one more question that queued up. They failed to record their name. Your line is open. Please check your mute button. If you queued up for a question and have not been able to ask it, your line is open.
Hi, yes, my name is Elise.
Go ahead.
Yes, I volunteer for a recovery learning center in Massachusetts, and we're not directly linked to any colleges, and I was wondering if we could get involved with the Love is Louder.
Yeah, actually, we're going to be opening our club structure up not just to campuses, but also to community groups, because we have had that happen organically. So sure, in some very minor situations, it requires a little bit of work, like with these screenings, for example, they're educational license, so we have to be creative. But the material the materials and the activities that we're seeing happen work in campuses, and communities. And we have had a number of even treatment centers, use them as well. So, yes.
And Courtney, what's the first step they can take? Should they contact you directly, or is there?
Yeah, I think you can email me directly. You can also go to the Love is Louder website, and when you go, if you let me look at it because I don't know why I'm forgetting that. But if you look under the ACT, I think it's an ACT, like Take Action menu option, you'll see the action kit. You can kind of start to look at some ideas. But certainly just email me and let me know kind of what your needs are and what you're interested in doing.
Okay, that sounds great. Yeah, I also work for Community Health Link in the respite. I'm not sure how we could integrate that, but it'd be great there as well. So I'll definitely keep in touch.
Yeah, when I'm encouraging people to think about how they can use Love is Louder, I use a really simple, practical example. I've worked on campaigns before where we've posted things on social networking like, did you know sleeping more than you normally do is a symptom of depression? And you just don't get any response to that. But if I put up Love is Louder than not wanting to get out of bed in the morning, we suddenly get all of these likes and all of these comments on that. So sometimes it's as simple as changing the conversation from things we might have, conditions we might have, to the way that we feel. So sometimes Love is Louder can provide an opportunity just to rebrand or to incorporate a new brand into things you're already doing that may connect with more people.
That's a good idea. Thank you very much.
There is another question on the phones. Darcy, your line is open.
Hi, I have another question for you. I've been working with Casey, I don't know how to say her last name, from MTV about the Half of Us videos.
Sure.
Do you know if there's any possibility of working, having those videos closed captioned? I requested the videos, and I have the release and everything to sign for MTV, but there's a lot of locations. We have a lot of TV monitors. There's a lot of locations that we can't have volume. And if we get the closed caption, that would be awesome. Do you know if there's any possibility of getting those Half of Us videos closed captioned?
Well, I'm going to put on my Love is Louder positive perspective here and say anything is possible.
So, Courtney, this is John. So we're looking into it. So I think it is something that we'll be able to do at least for some of the videos.
Right.
Awesome.
And then
great.
For the larger audience that may not know, if you go on the Half of Us site, and you can go now, but I also encourage you to go back like a week from now because it's going to be much better. We have a series of videos that are either PSAs, interviews with students or celebrities about their mental health issues, and then some like short features on issues like technology and emotional health on Half of Us. And most of those are available for educational licensing. So if you have some sort of on-campus network or events that you want to show them at, you can reach out. John, who's the best person to reach out to about that?
In our office, it's Gussie Fauché-Rothfeld.
Okay.
That's
so
what I call.
Yeah, what I'm doing for everyone right now, and give me like just a couple minutes and it'll be up. If after this webinar you go to loveislouder.com/SAMHSA, I'm going to put links to the videos, and then I'll put all of these email address links for different things in there too, so that everything's really easy and in one place.
Great.
Thank you.
There is another question on the phone. Right. I believe it's Sari. Your line is open.
Hi, yes. My name is Dr. Gari Saxena. I work at University of the Sciences in Philadelphia in their counseling center. And my question is for the LiveWell NYU team. I was really impressed with your campaign, and I'm wondering what kind of resources are necessary to put together something like that. I think one thing that's common in college counseling centers is just a lack of funding and a lack of time and staff who are able to really devote themselves to doing a lot of health promotion work. And I'm wondering what kind of resources you found that you needed to to have in order to put something together like that, whether it was grants or hiring new people or working with students already in the university? Thank you.
Sure. Hi, it's Carlo Ciatoli. So the approach we took at the beginning, because frankly we didn't have any dedicated resources to this initiative, was to involve as many people as we could across campus who each would provide us with a little bit of effort, and those were people both in and outside of our student health center. We did try to mobilize as many students as possible, leverage existing student groups, and, you know, to your point, we're certainly looking at other opportunities to add resources through grants and other types of funding, but we've really not had dedicated resources. Allison's been the one to coordinate, but really we've tried to leverage as much of the campus community as possible to, frankly, leverage a lot of what was already going on campus. You know, we're smack in the middle of New York City, so there are community activities, university activities that all support health and wellness. So our first pass through was simply to try to umbrella under the LiveWell NYU brand as many of those activities and events as possible. We did shift a little bit of internal resources towards LiveWell NYU to create the website and what have you. But philosophically, we just engaged as many people as we could, particularly students who did a lot of the heavy lifting in terms of developing content and providing some direction.
Thank you. That seems like a great approach also if you want to really engage students at their level. So seems like it works on a lot of different levels.
Agreed.
So far, no questions have formed.
Okay.
Once again, it's star one for questions on the phone.
No other questions, operator?
So far, no questions.
Okay. Well, I think we'll, I just don't know why my slide is not coming. Okay. Well, thank you to all of our presenters today, John McPhee and Courtney Knowles from the JED Foundation, and Dr. Ciatoli and Allison Smith from New York University. Also, I would like to thank you, the participants, for taking the time out of your busy day to join us for this webinar, and we hope that today's presentation on Love is Louder and LiveWell NYU campaigns have been helpful to you. Finally, I'd like to take this opportunity to close this presentation, this webinar, with information on the SAMHSA-supported National Suicide Prevention Lifeline at 1-800-273-TALK, which provides free and confidential emotional support to people in suicidal crisis or emotional distress 24 hours a day, 7 days a week. So persons worried about someone they know or love who is showing suicidal behavior can call the Lifeline for help or visit their website for chat options and other resources at suicidepreventionlifeline.org. And please, keep the Lifeline number close by in your wallet, your purse, your cell phone. Help us get the word out about the Lifeline number and the website through your community organizations, your congregations, and friends and families. Again, remember, everyone can play a role in protecting their friends, family members, and colleagues from suicide. Thank you so much. Goodbye.